Hello, my presentation today is over the bacteria Legionella pneumophila. What is Legionella pneumophila? Legionella pneumophila was discovered over 40 years ago during the 200th anniversary of the Declaration of Independence. Hundreds of American members were overcome with severe pneumonia, which later resulted in 29 deaths. The Legionella bacteria are located in the environment, usually in water. The bacteria grow well in warm water. Legionella species are the most universal inhabitants of water, resulting in 85% of all infections in humans being caused by Legionella pneumophila. What does Legionella pneumophila look like? Legionella pneumophila is a thin, aerobic, pleomorphic, flagellated, non-spore-forming, gram-negative bacterium. This single-celled bacterium contains over 40 different species. This bacterium is gram-negative and forms into a bacillus or kochi shape, giving it a slender appearance. The significance to the community. This bacterium and disease can easily cause harm to a community. For example, if Legionella pneumophila bacterium is grown within a town's water supply and the community is using this water for showering, swimming, air conditioning, or even just drinking, this could harm the community in many ways. It would have a negative impact on the community by creating a snowball effect, causing everyone to get infected. Thankfully, this bacterium is not highly virulent, making it less dangerous in smaller amounts of exposure. Transmission. Legionella species are the most universal inhabitants of water, resulting in 85% of all infections in humans. Legionella can live and breed as parasites within protozoa and within biofilms which develop in water systems. This bacterium is the common cause of water contamination worldwide, especially in man-made water systems such as spas, ponds, showers, swimming pools, vaporizers, aerosols, and air conditioning systems. The most susceptible hosts are immunocompromised patients, including organ transplant recipients and cancer patients, and those receiving corticosteroid treatment. Third world countries or undeveloped countries have little to no filtration in their water and are the most susceptible to this bacteria. Signs and symptoms. This bacterium can lead to a life-threatening disease called Legionnaire, which is a dangerous upper respiratory pneumonia. It is presented by fever, chills, dry, non-productive cough, and headache. Legionnaire's disease can also be linked with other symptoms such as diarrhea, nausea, and confusion. Symptoms usually start 2 to 10 days after being exposed to the bacteria, but it can also take longer to those exposed. Those exposed should watch for symptoms for about 2 weeks after being exposed. Diagnostics. A diagnosis is made by fluorescent antibody staining or other serological tests that reveal the presence of Legionella in clinical samples. The bacterium can also be cultured on suitable commercially available selected media such as buffered charcoal yeast extract. The most commonly used laboratory test for diagnosis of Legionnaire's disease is a urinary antigen test, which detects a molecule of the Legionella bacterium in urine. If the patient has pneumonia and the test is positive, then you should consider the patient to have Legionnaire's disease. Treatment options. There are no vaccines currently available for Legionnaire's disease. The non-pneumatic form of infection is self-limiting and does not require medical interactions. This disease can cause many common complications with organs such as gastrointestinal tract, kidney, liver, and central nervous system. If not promptly treated, pulmonary function rapidly decreases, resulting in death in 20% of patients with normal immunity. There is also the Pontiac fever that displays the flu-like symptoms but does not include pneumonia and is not fatal. Patients with Legionnaire's disease always require antibiotic treatment following the diagnosis. Physicians use doxycycline, macrolides, ciprofloxacin, levofloxacin to help treat Legionnaire's disease. Preventative actions. These steps include good upkeep of equipment, including usual cleaning and disinfection and applying other physical or chemical measures to diminish the growth. Some instances include the usual maintenance, cleaning, and disinfection of cooling towers together with recurrent and constant addition of biocides. Putting in drift eliminators to decrease diffusion and aerosols from cooling towers. Also upholding an acceptable level of biocides such as chlorine in a pool, along with a whole drain and clean of the whole system at minimal weekly. Keeping hot and cold water systems clean, and either keeping the hot water above 50 degrees Celsius requires water leaving the heating unit to be at or above 60 degrees Celsius and the cold below 22 degrees Celsius. Applying such controls will greatly diminish the risk of Legionella contamination and avoid the occurrence of sporadic cases and epidemics. Extra safety measures may be required for water or ice given to patients in hospitals, including those at risk of aspiration. Control and prevention actions must be taken seriously in order to effectively reduce the spread of Legionnaire's disease. Thank you for watching.